Recording.
This meeting is being recorded.
Okay. All right, so we researched a genetic disease, cystic fibrosis. Okay, so for a description of the phenotype, people who have cystic fibrosis, their cells absorb an excess of water and sodium, and so that causes thick layers of mucus in the lungs to clog up the tubes. And so that increases the chances of lung infection and also creates an environment that is um, good for harmful bacteria. And so this often causes symptoms like coughing and wheezing, and people often have asthma or other allergies. In the pancreas, there's a tube that releases enzymes to the body to break down food and bring the nutrients to the cells. And so this tube is also blocked by the mucus, which causes digestive problems and an inflamed pancreas. It's also very common to see infertility in men because the sperm canal is blocked, which prevents sperm from reaching semen, and so eggs cannot be fertilized. On the right, there's a visual of the lungs and the pancreas, the tubes getting blocked from the thick layers of mucus. Yeah. Okay. So on average, 1 every 5,500 babies are born with cystic fibrosis, but it's much more common in white populations. So on the map, you can see that countries in Northern Americas and Europe, Northern Asia, it's more common to see cystic fibrosis than other countries. So globally, an estimated 160,000 people have cystic fibrosis, but only an estimated 65% are diagnosed, and even less are actually receiving treatment. So infertility is very common in men, and 98% of people with cystic fibrosis are infertile. And also the life expectancy, if you have the disease, is 44 years.
And the genotype of the CF is a single gene disorder and inherited in an autosomal recessive manner. The gene for cystic fibrosis, CFTR, which stands for cystic fibrosis transmembrane conductance regulator, was identified in 1989 by Dr. Sui and Dr. Collins. The CFTR genes is on chrome 7. It is a huge gene, spans about 190 kb with an mRNA of 6,000 nucleotides and 29 exons. Many mutations were identified that affect the function of the protein. On the picture on the right hand side, and how a person gets CF. When two parents are both carriers, 25% of the child will have a CF, and 50% will be a carrier, and 25% will not be a carrier. On the right side of the picture, if the mother has CF and the father is a carrier, 50% of their children will have CF, and 100% will be a carrier. The classification of disorder of the CF is that most patients were diagnosed around the age of 6 to 8 months. The cystic fibrosis patient meets the following diagnosis criteria: is the CF core symptoms as described in slide 2, and the blood immunoreactive trypsinogen at top 1 percentile. The sweat test, you have to get a sweat test, you have to be 60 mm. And they also, another way is to do is the DNA genetic test with 2 CF causing mutations. The CFTR related metabolic syndromes, patients with high immunoreactive trypsinogen but does not fulfill the diagnosis criteria above, mostly with medium levels of SORT test and 0 or 1 CFTR mutations detected. These children often have clinical disorders similar to CFTR dysfunction, such as recurrent pancreatitis airway disease and congenital bilateral absence of the vas deferens. They may have CFTR mutations but was not detected in the DNA test panels or influenced by epigenetic modification and environmental factors. On the picture on the right, here is the CFTR related disorders on the organs. And some of the kids that was initially diagnosed as CFTR related metabolic syndromes were later diagnosed as a bona fide CF. The other way to diagnose the CF is the nasal potential difference in intestinal current measure. It is optional. There is a spectrum of CF clinical symptom severity and rate of disease progression. These may be due to different combination of CFTR mutant alleles, modifier genes, epigenetic modifications, and environmental factors.
So as we've been talking about the specific mutation that causes cystic fibrosis, it's at the CTFR gene, and that's located on chromosome 7 on the long arm. It's at locus Q31.2, you can see right here. This gene codes for 180,000 amino acids, so there's a lot of information there. And while there have been over 1,000 different mutations associated with disease, with cystic fibrosis, the most common mutation that you'll see is delta F508, which accounts for 70% of all mutations that are found and 90% of cystic fibrosis patients. And delta 508 is a deletion. It's a deletion of 3 base pairs, which causes a missing phenylalanine amino acid that's at position 508. So all of these different issues and problems are caused by missing 3 base pairs. And here, this is some histology pictures. This is the lungs. Right here, this big thing is the bronchi. It's dilated, and this is filled with some compacted material. Down here is the alveoli, and that also has some infiltrates in there. It's supposed to be much more hollow. Here, this is the liver. This hollow arrow up here is showing fibrosis and thickened connective tissue. And then these little white things, that's steatosis, that's fat deposits. This is the small intestine. And the hollow arrow, this is showing a gland filled with thick mucus, as we've talked about, associated with cystic fibrosis. And this is the pancreas. Down here, the duct is dilated. And up here, we have more fibrosis, thickened connective tissue. Here, this is the kidney, and this is showing some compacted matter in the distal tubules and some calcifications in distal tubules. And all of these are H&E stains.
So cystic fibrosis is strongly determined by genes, and it is an autosomal recessive condition in which only the recessive homozygote is affected. And in this case, that would be the lowercase ff. As mentioned previously, it is especially common in those who are from European heritage. It's 40 times more common in Europeans than Asians. And in 1 out of 25 white people, there is a heterozygous carrier of that mutation that causes cystic fibrosis. So in this case, if Edward and Bella have a child, they have a 1 out of 4 chance of reproducing someone who has cystic fibrosis, which would be Katniss. And if she mates with someone who is a homozygous dominant, they would reproduce children who are all carriers. And a man who does carry this allele thus has a 1 out of 25 chance of meeting another carrier if he mates with someone in that general population. Currently, there are a lot of treatment and therapies for cystic fibrosis, and conventional therapy has reduced the rate of lung function decline, improved nutritional status, and increased survival. This includes antibiotics, bronchodilators, mucus thinners, and anti-inflammatories. Inhaled antibacterials are recommended as a component of care for maintenance therapy. And in cystic fibrosis, the airway surface lung is depleted through the imbalance of defective chloride secretion and increased sodium absorption. So replenishing this airway surface liquid is another therapeutic target, either through drugs that influence the ion channels or osmotic agents that may replenish the airway surface liquid. And this gene defect for cystic fibrosis was discovered in 1989, and since then there has been a drive to explore the possibility of treatment by replacing the defective CFTR with the wild type CFTR, and this is a particularly exciting prospect as a new therapy for cystic fibrosis, while clinical studies are ongoing. Thank you.